Hello, hello. We are live. We are live. It is Medical Monday. I'm Dr. Frita, and we are about to talk about all of the hot health headlines in the news. We're going to start off with my favorite game, myth versus fact. Yes, myth versus fact. We're talking about how the Dancing with the Star, Val Chmerkovskiy, had a kidney stone, a painful kidney stone. And we'll talk about myth versus fact when it comes to kidney stones, what you need to know about risk factors and how to treat them. And then I'll give you your fresh take that you can't get anywhere else on your weekly dose of medicine. We'll start off with none other than Ms. Tina Knowles talking about how she put Beyoncé and Solange in therapy as young girls to make sure she kept these sisters close. Did it work? I'd say it did. So we'll talk about therapy and is it really effective for children in increasing their bonds? Then we'll talk about gout. If you know anyone who's had gout, you've heard them fuss and holler and curse. Well, guess what? Anthony Anderson shares how he got diagnosed with gout. So we'll talk about how to recognize the signs and symptoms, and most importantly, what to do about it. And now we're going to tussle with RFK Jr. yet again, because he's giving more misinformation. I declare this head of HHS just can't get it right. He talks about the doom and gloom of autism and what autistic children will never, ever be able to do. And Holly Robinson Peete is not having it. She's coming out red hot, and she is dispelling the myths and misinformation that he's putting out there with her son, RJ, who's a very successful person who is living with the spectrum of autism. And then I'll give you your 5-minute health check, where I'll just do a quick run through of some of the medical information you don't want to miss as far as certain things getting recalled, like your apple juice, as well as different infections that you need to be on the lookout for. We'll talk about it. And of course, as always, we have a live interaction. You can ask me questions and I can ask you questions too. So put your thinking caps on. This is Medical Monday. It's also Lunes Médico, porque es 5 de Mayo. Okay, let's get started, shall we? Hello, hello. We are live. We are live. I am Dr. Frita. This is Lunes Médico, 5 de Mayo. Let's get started with Medical Monday. We're talking about all of the hot health topics in the headlines. I'm not doing it alone. No, ¿Dónde está Shador? Shador, please come to the front of the stage. This is my office manager for over 12 years and, of course, my co-host here on YouTube Live. Welcome, Shador. ¿Cómo estás? How are you?
You're doing pretty good. How are you? Muy bien.
I know that's right. It's 5 de Mayo, 5 de Mayo. All right, Shador. Did you have a good weekend? I hope so.
Yeah, we had a pretty good weekend. Same baseball season's almost over.
Okay.
So we dealt with that this weekend. But other than that, nice and relaxing. How are you all? I know you
we had a good weekend. We had a good weekend. Lots of celebration. Both the twins had basketball tournaments, which went quite well. Lots of family in town as we did a homegoing celebration for my beautiful Aunt Barbara Jean Dent McCrae. She led a life that was so full. I was very close to my auntie. She was a wonderful businesswoman, a mother, a caregiver, and a God-fearing woman. She touched everyone's life. Anyone who knew her, when you're talking to her, you feel like you're her favorite person in the world. But, you know, of course, funerals are sad occasions, but this truly was a homegoing celebration to a life well lived, my Auntie Barbara. So it really was a good weekend. It was a good weekend. All right. So we had a good weekends, but there are some people who, Shador, really did not have very good weeks. So we will get started talking about them, including the person who had a kidney stone. But first, Shador, who was the first person in the chat?
First person in the chat today was Miss Aileen.
Hi, Miss Aileen. Welcome, welcome. Bienvenidos. Yes, y'all. I'm going to be popping Spanish on y'all all day for 5 de Mayo. Very good, very good. And for everyone else that members in where you're watching us from, we appreciate you. We have you here on YouTube. We have you on Facebook, do we?
Yep.
All right. And how about Instagram? Y'all come on in from Instagram. I want you to participate and please answer the questions because, honey, this is a quiz. I'm Dr. Frita and I will be giving medical knowledge and asking questions as we go along. So let's start off talking about kidney stones, Shador, because Dancing with the Stars, Val Chmerkovskiy suffered a painful kidney stone. And Shador, we talk a lot about kidney stones in general, but people really, I think in a lot of ways, don't know what they are, where they come from. They think, kidney stones, those will happen to someone else, but they're real. They're very painful. And of course, as a board certified kidney doctor, we treat kidney stones, and I see grown, tough, macho men cry and fall to their knees over kidney stones. So let's play this. We'll play this clip, and then we'll get into my favorite little game, myth versus fact.
From hell, midway through the flight, he passed a kidney stone. And he posted a picture of it too.
I hear that's worse than childbirth.
Having had them, I know that kidney stones are the worst pain.
Oh, really? Because you've given birth a couple times?
Would you stop one-upping people?
You just said it was the size of a pea. Siobhan gave birth to human beings.
But a penis doesn't enlarge.
Just think about that versus like, Christina.
Why did you go that big?
Because that's how they showed in horror movies for him.
I just love how the man is able to come and say for a fact that kidney stones are worse than having babies. I'm glad she called him out. We don't need him to mansplain and share childhood birth when he doesn't know. But yes, the person who does know is the Dancing with the Stars, Val, who passed the kidney stone on an airplane, I believe. And trust me, when I have patients who've had kidney stones, they say it's a 10 out of 10 pain. So to all of my med heads, let's get ready. Let's play a game, myth versus fact. Well, you put an M down if you think the statement is a myth, an F if you think it's a fact. Shador, let's get started with our first myth versus fact question. And before we do, please go ahead and give us a like and share. Let YouTube know we're here. Let Facebook know we're here. Let Instagram know we're here, because we're giving evidence-based medicine. And we're going to have some fun, too, on this Medical Monday. All right. Myth versus fact. Statement number 1.
All right. Eating citrus fruits can increase your risk of developing kidney stones.
Eating citrus fruits can increase your risk of developing a kidney stone. Put an M1 if you think this is a myth, okay? Put an F1 if you think this is a fact. Will eating citrus fruits increase your risk of developing a kidney stone? M1 if it's a myth, F1 if it's a fact. All right, myth versus fact statement number 2.
Drinking cranberry juice can prevent kidney stones.
All right. Will cranberry juice prevent kidney stones? Put an M2 if that's a myth. Put an F2 if it's a fact. Oh, I think I'm going to get y'all today. I'm going to trip y'all up with my little game, myth versus fact. And as you put in your answers, the M's, the F's, the M1s, the F2s, and so forth, I want you to please share in the chat, if you so desire, if you've ever had a kidney stone and what some of the signs and symptoms you've had. Tell your experience if you care to share. All right, pencils down. Let's see. Now, let's see who came and played my little game, Shador.
All right. A lot. Everyone is joining in today. Yes.
No, okay, what's going on? Okay, so for the first statement, read that one again, please.
Yes, ma'am. Eating citrus fruits can increase your risk of developing kidney stones.
All right. Who said it's a fact? Who said it's a myth?
So we got a mixed bag for both of them. I'm going to do a couple from here on YouTube and our IG as well. So we'll share a few. So our facts, Marina says it's a fact for this statement.
Okay, so Marina, you're saying that if you eat a lot of citrus fruits, then it'll give you a higher chance of having kidney stones. It'll increase your risk for kidney stones. All right, Marina.
Miss Andrea, our member.
Hey, thank you for being a member, Adria. Listen, for those of you who want to join our membership, we have members only videos. You get custom emojis, and then you also get a members only live where I do nothing but a live Q&A. Bring all of your questions. For those of you who are new to us here on YouTube, Facebook, Instagram, I am Dr. Frita. I'm an MD. I'm a medical doctor. I am a board certified nephrologist, meaning I'm a board certified kidney doctor and board certified high blood pressure doctor. I have also received board certifications in internal medicine, pediatrics, and most recently, I became board certified in obesity medicine. And so I like to learn a lot about a lot. And more importantly, I like to share a lot. And so if you want full access for a live Q&A where I just answer questions for the entire session to my members, join our membership. All right. What did our member have to say?
Oh, she said that it's a myth.
Hold up. She said it's a myth. So she thinks that eating citrus fruits will not increase your risk for kidney stones. Tell me again who said this, which member?
It was Andrea.
Andrea. All right, Andrea, I see you. Who else?
Also saying it is a myth is Miss Jenkins.
Hi, Miss Jenkins.
And from IG, they're jumping in. BB says a fact.
Hey, welcome from Instagram, BB. So you think it's a fact if you eat a lot of citrus fruits like lemon, limes, that it might increase your risk for kidney stones. Okay.
And Jaish as well from IG says a fact.
Aisha says it's a fact. Eating citrus fruits will increase your risk. Thank y'all for playing my little game. All right. If you eat citrus fruits, will it increase your risk for kidney stones? All right. Our member Andrea and Miss Jenkins are correct. It is a myth. It is a myth. Actually, if you eat citrus fruits, that will decrease your risk for getting kidney stones. And this is why. Citrus fruits like lemons, limes have a lot of citrate. And what citrate does is it often binds to calcium in your urine, and it helps to keep that calcium from binding to things like oxalate and phosphate. It helps to prevent the calcium from forming stones in your kidneys. So if you have kidney stones, or if you have a predisposition to kidney stones, if you're scared about it, then actually eating citrus fruits, doing some lemon water every day, having that citrate can decrease your risk for kidney stones. And I'll tell you, as a kidney doctor, for patients of mine who have recurrent kidney stones, then I oftentimes prescribe something called potassium citrate, just so that citrate helps to decrease the risk for kidney stones. Thank you for participating. All right, midheads, let's go for round 2. What's that second myth versus fact statement?
Drinking cranberry juice can prevent kidney stones.
I'm gonna get y'all good on this one. Okay, what do we have? I know it's got to be a mixed bag, is it?
Yeah, I think we got a mixed bag on this one also. Mickey says a myth.
Okay. Oh, she said a myth. So you don't think cranberry juice will decrease kidney stones? This is Mickey.
Mickey. Mm-hmm.
Hey, Mickey, you so pretty. You don't understand. Who had that song? Oh, I'm aging myself. But then didn't Nicki Minaj have a new Mickey song? All right, Mickey. So you say it's a myth. All right.
VE says it's a myth.
Hey, welcome back, VE. All right.
Miss Sherry. She says it is a fact.
A fact. All right, Miss Sherry. You think that drinking cranberry juice will decrease your risk for kidney stones? Okay.
Mm-hmm. Over from IG, we have Ella says it's a fact.
Welcome, Ella. Okay, so you think drinking cranberry juice will decrease your risk for kidney stones? Okay.
Dr. Richelle says a myth.
Now, who is this?
Dr. Richelle.
All right, Dr. Richelle. Mm-hmm.
And Lebo from IG also says it is a myth.
All right. Well, drum roll. Y'all need to follow the doc, because the answer is it is a myth. It is a myth. But let me tell you, okay, I love this question because I meant to trip you up with it. So drinking cranberry juice actually will not decrease your kidney stones. In fact, cranberry juice has oxalate, which in some cases can actually increase your risk for kidney stones. But here's the deal. You have heard about cranberries and kidney health, cranberries and urinary tract health, and this is where it can potentially be helpful. Cranberries have resin. So if you ever had a cranberry juice, especially like a 100% cranberry juice that's pure, it has that gritty kind of texture to it. Well, that's because cranberries have resins. And it is thought that those resins, that grit, can sometimes help to bind to bacteria in the urinary tract. And so theoretically, cranberry juice can help to bind and get certain bacteria, help to clear for urinary tract infections. But that's separate from kidney stones. It's separate from kidney stones. Drinking cranberry juice will not decrease your risk for kidney stones. In fact, it has oxalate, which might increase your risk for kidney stones. All right. Thank y'all for playing my game. Listen, I always love people. I love y'all in the chat who are bold enough to come out here and jump out and answer, because you know you're not going to be right 100% of the time, usually, but it makes it exciting and interactive. I have fun. I hope y'all have fun. Well, let's talk some more about kidney stones. First off, Shador, did anyone comment or make on if they've ever had a kidney stone or any symptoms they've had?
No, I didn't see any jump out.
Well, go ahead and put in the chat if y'all can tell me what some of the symptoms of kidney stones are, and then I'll go ahead and talk to you a little bit about the science behind kidney stones. Now, I told you, kidney stones will make my grown men cry. They're actually somewhat common. 1 in 10 people will get a kidney stone in the lifetime. Usually it's men. Yes, men get kidney stones disproportionately to women, but women certainly will get them too. It's oftentimes in men in their 30s and 40s. And some things that put you at risk for having kidney stones. Well, if you don't drink much water, if you're dehydrated. All right. I'm sorry about these technical difficulties. Yeah, I'm not sure what it is, but I'm going to technically tell y'all what a kidney stone is. I know that. Now, a kidney stone is when you have crystals or particles in the urine that stick together and literally form a stone. And so you can imagine that if you have a lot of hydration, a lot of fluid, then it's harder for these particles to find themselves the more water that's in the urine, right? And so if you're drinking plenty of water, that can help to decrease your risk for kidney stones. But for people who are dehydrated, that can put you at an increased risk for kidney stones. Also, if you have a family history or a personal history of kidney stones, and there are certain medications that can put you at risk, certain diuretics, certain antibiotics, antivirals can put you at risk, and other things that can put you at risk if you are someone who has a high oxalate diet. And foods that are high in oxalate, well, we mentioned cranberries, but also spinach, chocolate, nuts, even certain colas. So these are all things that can put you at risk for having kidney stones. So if you have a kidney stone and you get these particles that find each other and they stick, then they stick within your kidney system. And in order to pass, as the urine flows, they scrape the sides of your kidney insides, right? And that's what can cause the pain. It can cause bleeding, okay? Some people will even get fevers. And other complications include when the kidney stones, they might cause a blockage, okay? If a kidney stone is large enough, it can cause a blockage. So here, if you look at this photo we have a normal kidney on the left, and on the right, you have different spots of kidney stones. And if it's big enough to block your ureter, that's a tube that leads from the kidney down to the bladder. Then it can cause a backup of urine, which could lead to pyelonephritis or kidney infection, and even kidney failure, especially if both kidneys have kidney stones. And so you definitely want to make sure you drink enough water. Consult with your physicians. You know, most people will say anywhere from 2 to 3 liters of water a day for adults, or half of your body weight, ideal body weight in ounces for water. And you want to talk to your doctor if you have a predisposition for kidney stones and they're giving you a medication. Ask, hey, will this make my chances of getting a kidney stone worse? So certain anti-seizure medicines like Topamax can increase your risk for seizures. We do have treatments. We have things like shockwave lithotripsy, where we go in and can break up the kidney stone without an invasive surgery. And then we do have surgeries, percutaneous nephrostomy, where you can take kidney stones out, surgeons or urologists. And so there are other treatments, but of course, prevention is really what you want to do. And so kidney stones are painful. And I will say, I always ask my female patients who have given childbirth, who've had childbirth with no anesthesia, to compare kidney stones and childbirth. I have to be honest. Most of the women who've had natural childbirth and have had large kidney stones, they say it's comparable and that the kidney stones oftentimes are worse. So our guy on TMZ, even though we don't need him to mansplain, he hadn't had any baby, but yeah, that pain is pretty severe according to my sources.
Mm-hmm. Yeah, and Tony from YouTube, Tony says, I had them, I'd rather have 10 babies than pass kidney stones.
Oh my gosh. Yeah, oh my gosh. They're pretty rough. So y'all make sure you stay hydrated for many reasons. And I tell you what, after you finish this live, make sure you watch my videos. I have more than one video on kidney stones right here on YouTube. And I also have videos on the benefits of drinking water. Thank you for sharing. 10 babies, somebody help me. All right, go ahead. Please give us a like, please share. And then we shall get into our weekly dose. Well, I'll give you a fresh take on health in the headlines you simply can't get anywhere else. Ooh, let's start out with the mother of the queen bee. Let me tell you about the mother of the queen bee. Miss Tina Knowles, who has been in the headlines. You know, we talked about her here last week because she shared that she had a diagnosis of breast cancer last summer. And thankfully, she's cancer-free now. But she was honest and shared that she missed some mammograms. She got caught up, missed mammograms, and was diagnosed with breast cancer. And now she has a #1 book that's out, Matriarch, okay, where she talks about being the matriarch of her family. And of course, she's the mother of the queen bee, Beyoncé, and of Solange. Yes, Ms. Tina Knowles, she has her book, Matriarch, and she talks about how she put her girls, Beyoncé and Solange, in counseling because she started noticing that they had some division. Let's play that clip. And then I want you to put in the chat, do you think that counseling can really help children to have a better bond, siblings to have a better bond?
I think this is so interesting that you put your daughters in therapy at a very young age, at a time when it was considered taboo, especially in the Black community. I remember in 1986, when I started the Oprah show, everybody was like, I would never go to a therapist, and going to a therapist makes you crazy.
That's what
and
my
one of your
family-
siblings told you, you're going to make the girls crazy
Yes.
because they're too young.
Mhm.
Something in your instinct said the girls needed to go to therapy. Why?
I got so scared because they were like super close. Then all of a sudden, Solange was taking Beyonce's stuff, and Beyonce was kind of being a little mean to her. And I had never seen it before. It scared me to death because I was like, I want them to be close, and I want them to respect and love each other.
Is this after Beyonce started performing?
Yeah, Beyonce was performing. She was this little local, star, and Solange was she started very early too, but it was like people would, if they saw the two girls, they would say, oh God, oh, she's so talented. And you know how they do. And then my other child is there, and I'm like, hey, you better tell her something too.
Yeah.
So I didn't have any problem doing that. But I saw this thing, and I think
you saw the division.
I saw the division. And also what really shocked me and made me move forward with it was the girls, the group was at our house all the time. And I just noticed they started saying, sit down, Solange, shut up, Solange. And Beyonce wasn't defending her. So that mama bear, that defender in me said, you got to protect your sister. And she was like, but she gets on my nerves. She's all in my stuff. So that's why I took them. Okay. And it was the best thing I could have ever done for them because they got close again. And Beyonce started respecting Solange because, the therapist was saying, you're going to make your little sister, feel very insecure.
I love that. Let me tell you, we look at Beyonce as Queen Bee, as someone who's an innovator, who, does a lot of speaking out on women's pride, right? On being a feminist, on Black pride, she speaks out on political issues, on respecting people of all communities, including LGBTQ. And we see that, honestly, she gets it from her mama because especially in the Black community, there was, like, as Oprah and Miss Knowles were saying, there was a lot of stigma during that time as far as therapy, but she didn't care. And so I'm learning so much more about Miss Tina Knowles. And I want to know, Shador, did anyone in the chat comment on if they think that therapy really is helpful, that if it can help children, or if that's just a little bit of a foo-foo situation?
Yeah, a couple of people just chimed in with the answer. Marina, she says, absolutely.
I agree, Marina.
Mm-hmm. And I remember Miss Andrea said, yes.
It can. And it's really something because it's really tricky being a parent because your children are so different, right? Even in the same household, they're so different from each other, and they're going to have different talents. They're going to have different skills. And while you don't want to ever make one child feel bad, you also don't want to dim the light of another child who excels in something, right? So what is that balance? How do you celebrate the child who is, the dancer, the singer, the person who's being looked at more? How do you celebrate that child without dimming their light while not making the other child feel bad, And, I have twins. And so people constantly compare twins, and, oh, shoot, Shador, you are an identical twin. Mm-hmm. Comparisons is just a natural thing. So how do you take your kids into an outside world where they're going to be comparing, who's smarter, who's funnier, who's faster, who's prettier? They're always comparing them, but yeah, it can create a rivalry between twins or between siblings if you're not careful. And so I know I find myself being challenged because I refuse to dim the light of many of my children. So if somebody's getting straight A's and the other person's not, I'm going to celebrate the straight A's. But also if someone else is excelling in athletics, we're going to celebrate that, even though the other one might be as slow as a three-toed sloth. No offense to you, but we're going to celebrate. But I'm also looking at my children. Everyone has their own gifts, their own talents. And each one, like of my three, has a talent where they excel that the other one doesn't excel in as much. And so I definitely spend time trying to focus and highlight the challenges and to build esteem. But it's a trick. They have about 1 million parenting books out, but not one of them teaches you how to be the exact best parent to your child. So I definitely admire Miss Tina Knowles. Yeah. All right. So as we get ready to move on into our next topic, I do want to ask, did anyone ever talk about kidney stones or share that they had kidney stones? Now, look, I told y'all 1 in 10 people will have kidney stones. So I know some of y'all in this chat have had kidney stones. But if you care to share, please do. We can pop back to that discussion. Other than that, we'll move on to our next. Anyone before we move on?
Jose.
Hi, Jose.
Jose said, I drank chakra piedra and was able to pee out the small stones I had in my kidneys.
Interesting. So yeah, so if kidney stones are small enough, so 80% of kidney stones will pass on their own. So that's the good news. 80% will pass on their own, especially if they're less than 4 millimeters, and many less than 6 millimeters will also pass. If they're going to pass, they're usually going to do it within the first few weeks. If you're still having very painful stones after 4 to 6 weeks, then it's recommended that you go in and see your doctor, and you might be a candidate for one of these procedures. Or sometimes doctors will have different treatments before we get to an invasive procedure that can help you to pass a stone. So you were able to pass your stones. For men especially, it can be painful because if you imagine the urinary tract, the stone going from the kidney down to the ureter, okay, the ureters attach your kidneys to your bladder. Now for women, there's a short distance from the bladder to the outside world, right? We have a short urethra, a short distance. For men, from the bladder to the outside world, you have to travel through the male organ. And that's what makes kidney stones very painful, especially for men. And so I'm glad you're on the other side of passing your kidney stones. And please make sure you consult with your doctor, who I'm sure will tell you to stay very hydrated, to have a low salt diet, to try to have a low oxalate diet. And if they actually were able to examine your stone, yeah, so for people who are passing stones, if you're able to get a little something, a little cup, a little net and catch the stone, that actually helps your doctors because we're able to analyze the stone. And you saw that the Dancing with the Star Val actually saved his stone. That was a good thing because we can tell if it's a calcium oxalate stone. Is it a uric acid stone? What kind of stone is it? And depending on the stone, that could change the treatment. And so congratulations for passing the stones. Oh my gosh. All right. Anyone else?
Yeah, I am paralegal. She says my husband, his big brother, and his little sister had kidney stones recent. Sister-in-law had to have a procedure to pass them.
Interesting. Welcome back. I am paralegal. I love when you join us. So yeah. So remember I said having a family history can put you at risk for kidney stones. And so it's possible that, being in the same family, they could have some type of a predisposition, or it could be coincidental and they might be walking around being very dehydrated. That's something to check out too. The other thing is, do they happen to just hold on to a lot of oxalate? Do they have high uric acid and they're having uric acid stones? I would definitely encourage them, if they haven't already, to be seen by a nephrologist like me, a kidney doctor, because what we can do, I am paralegal, we can collect their urine. We call it a Euro risk panel. And they may have already had this done, but in the Euro risk panel, what we do is we literally analyze the particles in the urine. How much calcium do you have? How much oxalate? How much phosphate? How much salt do you have in your urine? How much uric acid? We look at the pH balance. Like, is it acidic urine? Is it alkaline urine? And it helps us to determine what kidney stones you are likely to develop. And from that, we can treat you. But I can tell you right now, a universal treatment is hydration. And so I'm sorry they've had all those stones. Also, infections. Shador, sometimes having urinary tract infections, you can get predisposed to having these struvite stones, which are huge stones. Stones can range from being the size of a millimeter or so, all the way to the size of bigger than a golf ball. It's a hot mess. I'm sorry your family has had to live with that. I am paralegal. I thank you for sharing.
And I just read this. I am paralegal says, is this really Shador, her identical twin? I have my glasses on today. So.
I am paralegal is a mess. Listen, I wish your twin were there now. You wouldn't know the difference. Well, once you pick up and they start talking and you get a sense of the personality, you would know the difference. But just on how they look at a glance, look, I am paralegal. I've gotten them confused. It doesn't take long to figure it out. But oh my gosh, yeah. They're definitely identical twins. And I know I've shared before probably, but one time we were at a community service project. One had the hair down, one had the hair up in the ponytail. We all had on the same t-shirt. And so I was like, okay, I know the ponytail, which one that is. I know which one is Shador. Child, it got hot out there. And don't you know they both put their hair in ponytails? So I went to Shador's twin asking her something. And instead of her just quickly saying, oh, I know you're looking for Shador, she gonna look at me and let me finish all the stuff I'm asking her. You must be wanting to talk to Shador. I'm like, don't look at me like y'all are identical twins. Where's your door? Yeah, but they are identical. All right.
All
Anyone
right.
else comment before we move on to our next
Yes,
story?
one for Miss Denise.
Hi,
Hi.
Miss Denise.
She says, my husband had kidney stones way back in the 70s, and I remember the excruciating pain that he was in, and I couldn't get him to the hospital fast enough. It was at nighttime.
Oh my gosh. Yeah, that's definitely a nightmare having kidney stones. I'm telling the truth, aren't I, Miss Denise? It'll make you a grown macho men wail and cry like you wouldn't believe. So I believe all my patients who have said the kidney stones are severe. So again, consult with your physicians if you've had kidney stones, and certainly check out my videos right here on the Dr. Frita YouTube channel. And I'll talk about the painful truth about kidney stones. And for those of you who are watching us from Facebook and Instagram, you can certainly on Instagram, click the link in my bio and you'll see where it will take you to latest YouTube videos, and you'll be able to look up those kidney stone videos after you're finished with this live. All right, so please go ahead, give us a like, and make sure you give us a follow on Instagram, follow on Facebook, subscribe, and hit the notification bell right here on this YouTube channel. We have hundreds of videos here on this YouTube channel. I'm excited. Again, we have over 854,000 subscribers on YouTube. We're doing our walk to 900,000. Please help to get us there. And I did release a new YouTube video just last week where I'm talking about the science behind stress and high blood pressure. It's real. Y'all think stress is just something that gets on your nerves? No, it can affect your health. So make sure you check out that video after this live. All right. Now let's go from one painful thing to the next, Shador. I talked about kidney stones and how they can make my grown men and even my tough super women cry. Another thing that can do it, gout. Gout can definitely do it. I want y'all to share it in the chat if you or someone you know of, a loved one, has had gout. And if so, I want you to please share some of the symptoms and share the triggers. Share the foods that will send you or that loved one into having a gout flare. Meanwhile, let's talk about Anthony Anderson, because y'all know he's a comedian and actor. You know he's hilarious, but honey, when he got diagnosed with gout, it was not funny. Let's play that clip, please, Shador.
You know what's crazy? I was living in New Orleans for a while, shooting the show there.
That place will give you gout.
Yeah, I was like, I'm gonna be healthy.
Not the place.
I was eating nothing but seafood and shellfish. I was like, oh, I'm just eating seafood and shellfish. But all the purine in the shellfish contributed to my buildup of uric acid. I'll never forget, I was in the scene and I went to kick a door in and I hit it. And I was like, ow, I think I broke my toe. And I finished the scene. Then we moved locations. We were filming in a hotel in the middle of the night, and I was laying across the bed, and they said, action. And I jumped up to run and chase the perp, and I put pressure on my right foot, and I collapsed. And I was like, oh, yeah, I broke my toe. I went to the doctor the next day, limping in. They were like, what's wrong, Mr. Anderson? I was like, I kicked the door, and I think I broke my toe. They're looking at it like, I don't think you broke your toe. I said, yeah, no, I think I broke my toe. They're like, you might have the gout. I was like, nah, I ain't got the gout.
That's not for me.
I was like, Dr. Kotler, let's go on an x-ray. They humored me. And I was like, okay, Mr. Anderson. Took me to x-ray that shit. Came back 30 minutes later and said, okay, we got good news and bad news. Which one do you want first? I was like, the good news. All right, you didn't break your toe. I was like, what's the bad news? You got the gout.
He got the gout. Listen, the gout, as they say, is really something serious. And it's interesting. He said he was in Louisiana, so he's eating a lot of seafood. And if you eat seafood like shellfish, if you eat organ meats, if you eat sausage, even sometimes chicken, turkey, specifically deli turkey, it has purines, which can be broken down to uric acid, and that can increase your risk for gout. But here's something else that we know happens in New Orleans a lot and in Louisiana. Having all those drinks, and their drinks are stronger than strong. Well, having alcohol can slow down the way that your kidneys get rid of uric acid, and that can also increase your risk for gout. I don't know if Anthony Anderson was having any, but I know everybody around him probably in Louisiana, or a lot of people were drinking. So imagine combining shellfish with alcohol. That can certainly send you into a gout flare. And so we'll talk about what gout is, but first I want to know, did anyone comment on having gout or talking about some of the triggers of their gout?
So, Dr. Frita, you just hit on everything Marina put in her message.
Who, Marina?
Marina says foods high in purines, red meat, organ meats, and certain seafood can trigger gout, flares. Such sugary drinks and alcohol, especially beer, can also increase uric acid levels.
Perfect. See, Marina, comes to you in the front of the class, medhead. Come on, Marina, you in the front of the class. Those are all the things that will do it. You break down these purines, and yes, you get uric acid, which can cause crystals in your joint and give you a gout flare. And again, as you mentioned, the alcohol will slow down the way that your kidneys get rid of the uric acid, increase uric acid in your blood, and give you gout. So let's talk about what gout is. Let's talk about what gout is, and let's put up that graphic, please. So gout is a disorder when you have a buildup of uric acid in the blood, and that uric acid forms crystals. Now, we know crystals are nice and pretty when we're talking about jewelry and things of that nature. But when it comes to your blood, there's nothing cute or nice about crystals, because what happens is the uric acid forms uric acid crystals, and those crystals migrate to your joint. Most often the big toe. It's most often in the big toe, but it can be in your elbow, it can be in your knee, it can be in your ankle, it can be in your wrist, it can be in other joints as well, just most often in the big toe. So your first toe. What happens is once those crystals go there, it's kind of like shards of glass in your joint, if you can imagine. And so that causes an inflammatory process. And so you have all these other inflammatory cells, these white blood cells, mast cells, histamines, all these inflammatory cells migrate to that joint. And then what happens? You get lots of fluid, swelling, redness, warmth, tenderness. And like in the case of Anthony Anderson, you feel like you've broken your toe. And this is from gout. Just like with kidney stones, guess what? Gout is more common in men than women as well. Yeah, gout is more common in men than women. They're like 3 times more likely to get gout. But for women after menopause, hello to all my perimenopausal and menopausal women, after menopause, guess what? We can start getting gout as well. You can certainly get it before menopause, but your chances will increase, women, if after menopause. But men, y'all are on the clock the whole time. And there are different risk factors associated with gout. Definitely what we talked about, eating those meats, but then there's definitely family history. Okay, some people are just more predisposed to it. Living with obesity can put you at increased risk for gout. Having diabetes can put you at increased risk. But gout is another one of those things that will send my grown, tough, macho men and women to their knees. I mean, you heard Anthony Anderson. It was so bad he literally thought he broke his toe. All right. Anyone else commenting on gout as I keep talking?
Mr. Miles, he says, so my brother has gout. Red meat, alcohol, and bacon are his triggers.
That's it. I'm sorry that your brother has gout. And it's funny, all these foods that we're mentioning are like some fan favorites, right? Some rich foods. Even if you don't eat the ultra processed foods like bacon every day, even if you don't eat red meat every day, oftentimes that's like a big treat with celebration. Take that and combine that with alcohol, and you already have a predisposition to gout, and you're out of gas. I'm sorry your brother's living with gout. I hope that he has good treatment, because we do have some preventions in addition to proper diet and trying to avoid excess alcohol. There are some treatments as well. All right, so let's talk about it. Let's talk about what some of the treatments are. So yes, lifestyle. You figure out your triggers and you try to avoid them. So those organ meats, the shellfish. Shador, some of my patients, we've had patients where cabbage, for whatever reason, can be a trigger.
Mm-hmm.
It's very odd, but I've had it in
apples. Green apples are a trigger for her.
Who?
Oh, my patient said green apples are a trigger.
Isn't that something? And when you have gout, you know what your trigger is. So that's less common, but really pay attention to your diet and the timing of the gout flares. Most of the flares will last about a week or two and go away. But here are some things that we can do medically to prevent and treat flares. One medication is called colchicine, and colchicine should be taken when you feel the gout flare coming on, because colchicine does not actually treat the uric acid levels. It doesn't actually treat the gout itself. But what it does do is it slows down those inflammatory cells I talked about, the ones that like to rush and migrate to the problem and cause all the swelling and the pain. Colchicine will be like, all of you, histamines, mast cells, white blood cells, y'all slow down. Don't go to this joint. And so it will decrease all that pain and swelling and fluid retention in the joint. But it must be taken right at the beginning of the gout flare. It's not going to help you if you're taking it after the flare has started and, weeks into the flare. So that's important to know about colchicine, because while it's a great medicine and it's one that I do prescribe, if it's taken, especially in excess, it can increase your risk for kidney disease. So if you're taking colchicine daily for gout, please call your doctor right now and ask the proper way to take colchicine. Other treatments are ones that would decrease the levels of uric acid in your blood. Medicines like allopurinol, and the one that I actually use most commonly in my practice is uloric, because it tends to cause less kidney damage and less reactions. And so these medicines will decrease the uric acid in your blood. And of course, if you have less uric acid, it's less likely to crystallize in your joints. Other things that will happen that can treat steroids, just a short course of prednisone that can help to decrease the inflammation. And again, no, I'm not recommending that you're on prednisone every single day, because we know prednisone is loaded with side effects like weight gain, increasing blood pressure, increasing blood sugar, causing you to have a moon face or like fat around the face, buffalo hump, a lot of fat on the back. I'm saying moon face and buffalo hump. That's how I learned it in medical school. But these really are not politically correct terms, I'm quite sure. Prednisone long-term can also cause deep, dark stretch marks. It can cause weak bones, osteoporosis, decrease your immune system. I say that to say that when a doctor gives you a short course of prednisone and no refills, please do follow that and don't go to other doctors like, hey, can you refill my prednisone? No, we do it for a reason. Prednisone is good to get rid of an acute gout attack, but long-term for gout, every day, no, that's not what we recommend. And there's some other treatments too. Oh, like NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, meloxicam. Again, those drugs, the NSAIDs, can worsen kidney disease. So if you already have CKD or kidney failure, but even if your primary doctor says, oh, here's some NSAIDs, if you know good and well you're seeing a kidney doctor, give us a call so we can see what's the best medicine for you. Because a long-term NSAID dose for someone with CKD, even if you are having a gout flare, can send you into kidney failure. So just be careful about that. All right. So as we get ready to move to our next topic, if we have any more gout comments or questions or statements, I'll take those. Other than that, we'll keep on moving. Don't stop. Hey, keep on moving.
Shout out to our member, Miss Elaine.
Hi, Miss Elaine. Thank you for being a member. Oh, Miss Elaine, I just posted a members only video this weekend. What was I doing? It was on what day? Oh, Saturday. Child, while sitting in the parking lot about to go into my son's AAU basketball game. I wonder what I was talking. Oh, I know what I was talking about. I was talking about my weekend, and I was talking about some medical issues as well. So yeah, check that out. It's a members only video. And for anyone else, please make sure you press the link in the description to become a member on YouTube. Come on over to YouTube, join us. We have a good time. And remember, my one-stop shop, dr.frita.com, DRFRITA.com. That'll let you know not only how to join the membership, but it'll also link you to watching my different videos, my television appearances. Oh, I had a television appearance this weekend, just yesterday on Sunday. I was on Good Day Atlanta. I love going on there. And we were talking about, it was health headlines with Dr. Frita. I love that. And so we talked about Miss Tina Knowles and her breast cancer diagnosis. And I highlighted the fact that Black women are 41% more likely to die of breast cancer than non-Hispanic white women. We also talked about whooping cough, which is what we talked about here last week, and how the cases have actually, by some studies, quadrupled. Yeah, and it's why? Because of the misinformation about vaccines. Okay, so babies are actually dying from whooping cough because they're not getting vaccines. It's totally preventable. At least having death from whooping cough can be preventable. And we talked about lupus because May is Lupus Awareness Month. And so we talked about lupus. We talked about some celebrities who have lupus. Hey, put in the chat if you know of any celebrities who have shared that they are living with lupus. All right. But thank you for being a member. All right. Let's move on to our next topic, and then I'm going to circle back. And if you know of any celebrities, just put those in there on Facebook, IG, on YouTube, and then we'll talk a little bit about lupus real quickly as well. All right, y'all. RFK Jr. Y'all know I stay tumbling and tussling with him. So y'all know that RFK Jr. is the head of HHS. He is not an MD. He is not a DO. He is not an RN. He is not a scientist. He is a man who spreads a lot of misinformation, unfortunately. He very publicly has spread misinformation about vaccines for decades, including at one point saying that the measles vaccine caused autism, even though we know that that is not true. He's also now doing what he does, sharing misinformation about autism, where he has been stating pretty much the gloom and doom picture of people who are living on the autism spectrum as if they will never have any type of quality of life. And then he just play this clip because he's on my nerves today. We'll talk about it. And Holly Robinson Peete gets them together.
Autism destroys families. And more importantly, it destroys our greatest resource, which are our children. These are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted.
That was our Health and Human Services Secretary, Robert F. Kennedy Jr., projecting a small and limited life for children diagnosed with autism. In the same breath, he also baselessly claimed that autism is preventable and due to environmental causes. Researchers who spent decades studying autism have never narrowed it down to just a single cause. RFK Jr. didn't just face backlash from experts, he also received widespread criticism and condemnation from autistic people and those who know and love them. That includes actress Holly Robinson Peete, the mother to a 27-year-old son with autism. And Holly Robinson Peete joins me now to discuss this. She's an actress, author, co-founder of the Holly Rod Foundation with her husband, and she has used her voice in a very powerful way to discuss this. Holly, thanks so much for being with us. I saw something that you posted. I was deeply moved by it, and I wanted a chance to talk to you about this. So thanks for being with us today.
So happy to be here and speak with you. I just, even hearing it again, I can't tell you how viscerally I react. I cannot believe that he said the things that he said. I cannot believe that in 2025, we're still relitigating the possibilities for people who are on the spectrum. It's amazing the language that he uses. It sounds to me, Michelle, like he's never sat down with a family and never even had a conversation with anybody who has autism or who loves someone with autism. It just is mind-blowing. The dangerous, negative rhetoric that he put forward. I had a never day in 2000 when I sat next to my husband and a pediatrician who told us all these things our son would never do. And he was only 3 years old. And it was devastating. He would never speak, say, I love you. He would never play team sports. He would never have meaningful employment, friends, all the things. And if I had just curled up in a ball and, just given into those nevers, I don't know who RJ would be today. Mm-hmm. But this is dangerous language and we cannot have it.
Shador, I'm almost speechless, which I never am.
Mm-hmm.
That RFK Jr. sat up there and said that these folks, the children on autism spectrum, would never play baseball, never have a job, never play taxes, never be able to use the toilet unassisted. Has he never met an autistic child?
No, obviously not.
He just painted them as if they just are burdens on society with no kind of life. That's why I was excited. And if you watch that full interview, Holly Robinson Peete goes on to describe her son, RJ, has himself a job, has to pay taxes, all of the things, and has a very good, full, meaningful life, as many people on the spectrum have. And so if you, in the chat, if you're listening and you know a child, have a child, know a person who's living on the spectrum of autism, please share your experiences. And if your child is having any type of thrive, and we know that it's different for every children. There are different levels on the spectrum, different levels of severity. But just like him saying that they'll never hold a job and never get a chance to play a sport, and he's just discounting a whole group of people, which lets you know clearly this head of our Health and Human Services is woefully uninformed when it comes to autism, among other medical issues. And I just don't know how this man, yes, I do. He's unqualified. But here he is. Even his sister, who shares how much she loves her brother, he's a great person, all of that. But even she was on an interview just last week saying just how much she disagrees with him on so many levels and how he's just not qualified. And he's not. And I know, Shador, I've been on here, on the media, on different social media outlets, as well as national news shows, where I will combat the misinformation shared by RFK Jr. And I've had some people in comments, most of these supportive, always mostly supportive, but some people say, she doesn't know what she's talking about. He's the expert. What expert? He's not an expert. I'm an MD. I'm a medical doctor. I actually read scientific articles, but it's funny how he has that high position. And so people automatically assume that this man is the expert, whereas other folks of us who've actually done the work, gotten the credentials, gotten the board certification, and who just read, who just read. We actually are qualified to speak on medical topics, but some folks, just based on his position, will assume he's an expert. And that's what's scary about RFK Jr. being in that powerful position. All right.
You know me, myself personally, have a cousin. He's now 23 years old.
You know, I know your cousin.
And you know, same as Holly said, you know, he played sports. He drives, he has a job, he pays his taxes. He wasn't vocal or verbal, but now you can't give him the hush. So
absolutely. But someone like RFK Jr. would, you know, look at him at the age 3 with his diagnosis and sit up there and give him a Neferdine, what he would never be able to do. And I've watched that child progress over the years to now a young man. And RFK Jr. could not be further from the truth, but he's standing in front of all of these official governments. You know, he's on this high platform, this podium, and he's spewing misinformation. And so, if nothing else, I just hope that everyone who hears the sound of my voice on this chat, on YouTube, IG, Facebook, everyone, please, 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 when RFK Jr. says something, just go look it up for yourself, because sadly, he's giving misinformation. I just can't put it any other way. So RFK Jr., you and I are tussling again because you have spread misinformation about autism.
Yeah, speaking of autism, I am paralegal. She does have a story to share. She says, my daughter's friend has an autistic son. He goes to the bathroom on his own, but he doesn't like to be touched. Each person with autism has their own path. Absolutely.
Because you will actually find some children on the spectrum who are huggy and who do like to be touched, but they might not like a lot of eye contact. They might get overwhelmed and hyperstimulated when they're in large crowds, when there's a lot of noise. You know, it just varies. That's why they call it a spectrum. And so for RFK Jr. to stand up there and just give all of these nevers, including never using the toilet. Are you kidding me? Yeah, thank you for sharing. I am paralegal. All right. So as we get ready to move into our next segment, please go ahead, give us a like, give us a share. We appreciate you for being here with us here on Medical Monday on Lunes Medico. Hey, now is anyone going to celebrate Cinco de Mayo? Child, I'm not, but I sure like to talk about it. Also, make sure that if you have not done so already, that you check out our podcast. Yes, we have a podcast, and you can find it on Spotify. You can find it on Google. You can find it on Apple, wherever you listen to your podcast. Okay, Healthy Happy Life podcast with Dr. Frita, and it's really good because we know you like to look at our faces. Strike a pose. But if you just want to listen to us and not necessarily look, if you want to listen to us while you're driving, while you're walking the dog, while you're folding clothes, while you're doing other things, the podcast is a way for you to still get our evidence-based medical information and not be distracted with vision. So please check out our podcast and do me a solid. Give us a 5-star, if you will. The other thing, I did mention that we have the new video that I put out last week on stress, the science behind stress and high blood pressure. But please don't forget, I do have a book on blood pressure, Under Pressure, a guide to controlling high blood pressure, where I talk about not only the medicine behind treating high blood pressure, I also talk about the mechanism of high blood pressure and ways to lower blood pressure naturally. Okay. Using food as medicine, juice as medicine, meditation as medicine, exercise as medicine. Okay. There are so many ways to lower your blood pressure holistically. And it's not one or the other, black and white. I practice integrative medicine. Sometimes you need medicine. Sometimes you need lifestyle. Oftentimes you need both, and you always need the lifestyle. So check out that book. You can go to drfrita.com and go ahead and give it a purchase, and honey, give it to your mother for Mother's Day, because Mother's Day is coming up this weekend. All right. And if you enjoyed this conversation, again, make sure you join our membership where you can do the live Q&A. But if you want just a one-on-one conversation with me, hola, ¿cómo estás? Then please, I have a telehealth concierge service where I can take a full history and give you my medical information on whatever medical issue you're going to, give you a second opinion. We can just have a chat back and forth, and we can do this from anywhere in the world. So click the link in the description or go to drfrita.com to take advantage of this telehealth concierge service. I've been having so much. I've met people from all over the world and been able to give them some really solid medical information. So check that out. All right, Shador.
But Dr. Frita, before you move on,
a 5-minute health check.
Yeah, before you move on, IG, we do have a comment from IG.
Hey.
J Hud, she says, just watched a video of my 9-year-old great-grandson's piano recital. His parents are both professional teachers and musicians. He's on the spectrum.
Look at that. So he's making music, playing music, and we know that music is medicine for the soul. So really having a quality and a purpose in something that's enjoyable and helpful, I'm sure to him, but also to other people. Don't discount people who have autism or who are living on the spectrum. Don't do it, RFK Jr. Thank you for sharing, J Hud. All right. So now let's do our 5-minute health check. Shall we, Shador?
Yes.
All right. This is where I give you just a quick rundown of some medical information. Sometimes it's recall. Sometimes it's infections on the run. Let's see what we're going to get today. What you got, Shador?
All right. Over 900 U.S. measles cases and counting. Are we facing a national health crisis?
Yes, we are. Y'all, measles. You will recall that in the early 2000s here in the United States, we declared that measles was eradicated. Yay. Why? Because we have the measles vaccine. And even though measles used to literally kill children, once we got the vaccine, we eradicated it, or so we thought. Now, with the misinformation, less and less people are getting vaccinated for measles. More and more people are getting it. So now here in this year of our Lord 2025, we had our first death in a decade from measles. And now we've had at least 3 deaths. And with those 2 children, they are reportedly unvaccinated. Now look at all the cases we have, mostly in unvaccinated kids. So make sure, again, you educate yourself, because RFK Jr. has been spreading misinformation about measles. Although I will say, a broken clock is right twice a day, because he did come back and say that the best way to prevent measles is through the MMR vaccine. Hello, we already knew that, but that's okay. Make sure you consult with your pediatricians, consult with your doctors, because 2 doses of the measles vaccine will give you a 97% protection from getting the measles. Okay. It's not just a matter of a rash and a fever. Measles can cause encephalopathy, can cause pneumonia. It can and does cause death.
Recall, health alert. Martinelli's pulls over 7,000 cases of apple juice over mold contamination.
Shador, do you know my daughter's favorite juice, Avery's? Apple juice. Okay. So Martinelli, specifically in their 10-ounce glass bottles, they found mold in the apple juice. And so if you're an apple juice drinker, if your children are apple juice drinkers, please go look. And if you have one of these glass bottles, 10 ounces, then you may be among the 7,000 bottles that have been pulled. The good thing as far as this mold, so far, the symptoms that they found, it might cause nausea and vomiting, things that are self-limited. But in some cases, they think that this type of mold can actually alter your DNA. So if you're an apple juice drinker, just hold up, wait a minute. And if it's Martinelli's 10-ounce glass bottle, just pause for a minute, check it, and see if you're getting recalled. Over 7,000 cases, 7,000 bottles.
Telehealth meets weight loss. Wegovy goes digital.
Now, this is interesting. So, when these different GLP-1 agonists, like the Wegovy, Zepbound, Mounjaro, Ozempic, when they were in short supply, then pharmacies were being permitted to make compounds, right? Like almost like a generic or a substitute for the actual name brand. But now that these medications are in high supply, then the pharmacies are no longer permitted to make the compounds, which means that people who want these drugs, if their insurance doesn't cover it, they're just out, $1,300 a month, which many people cannot afford. Well, what Novo Nordisk has done, the maker of Wegovy, they've partnered with 3 telehealth services where they will give a markedly discounted price for the Wegovy if you get it through those telehealth doctors. So check it out. And the price that I saw quoted was $600. So that's about half off if you're someone who is living with obesity, or if you're living with being overweight and you have a couple of other comorbidities like high blood pressure, diabetes. If it's something like that, then it would be FDA approved for you to take the Wegovy. And now you can get it possibly at half price or a different discounted price. So yeah, this is when technology meets health. Novo Nordisk. All right. So that ends our 5-minute health check. Please give us a like as you head on out of the door, and make sure you check us out. So for those of you who are members, yes, we do have that members only video that I put out for everyone. Please come check out on YouTube the video that I released on stress, the science behind stress and high blood pressure. And I also released some shorts. It's there for you on Facebook. It's also there for you on IG, where I did a little bit of a highlight of me being on Good Day Atlanta. And my daughter was in town. You know, she's a broadcast journalism major. So she got a chance to be there behind the scenes while I was filming with my friend Caitlin Pratt. We always have such good conversations when we're talking about lupus and everything else. Oh, Ushador, I don't know. It might be too hard to find it in the chat. Did anyone put any celebrities they know who have lupus?
Miss Pat D.
Hi, Miss Pat D.
Her comment. Toni Braxton.
Yes, Toni Braxton has been very vocal. She has lupus. She has had heart disease with it, pericarditis, which is an inflammation around the heart. She's had coronary artery disease. She's had just severe fatigue. And we know that lupus is an autoimmune disorder. So instead of your antibodies and your immune system just fighting the outside bacteria, viruses, and germs of the outside world, with an autoimmune disease, your immune system turns on you and it starts attacking you. So the same way an autobiography is a book that one writes about oneself, an autoimmune disease is when the immune system attacks oneself. So Toni Braxton, yes, has been very vocal. She seems to be doing very well, but she shared that it has not been easy living with lupus. Okay.
All right.
Yeah. And the other thing with...
Oh, no.
Yeah, 90% of the people who have lupus are women, but men can get it too. Nick Cannon has a diagnosis of lupus. He shared that. And also Selena Gomez. Selena Gomez has lupus, and her lupus actually attacked her kidneys, where it sent her to kidney failure, and she's now living with a kidney transplant. So yeah, so check it out. I will put that Good Day Atlanta clip up. I'll put it up sometime this week. And just kind of check me out. Follow me on all social media platforms at dr.frita. You'll be able to see that. All right. So with that, I certainly thank you, Shador, for being my wonderful co-host here today. I thank you to everyone here on the chat, of course, right here on YouTube, where I'm excited that we have over 854,000 subscribers. We're slowly marching to 900,000. So please make sure, if you haven't already, pop on over to YouTube, give us a subscribe, hit that notification bell so you'll be among the first to know when we release new medical content. Thank you to everyone who's watching us live on Facebook. Give us a share. Go ahead and put us in your family Facebook page, in your exercise Facebook page, in your health awareness Facebook page. Give us a share over there, because we're giving evidence-based medicine every Monday, every medical Monday, every lunes medico en Cinco de Mayo. Yes, honey. And then also thank you to everyone on IG who y'all participated and y'all answer questions. I appreciate you so much. All right. So we'll see you next week, Monday, noon Eastern Standard Time, same bat place, same bat time, right here on Medical Monday. I'm Dr. Frita. Hasta luego. Feliz